Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot, but it's going to be slightly different. Instead of multiple choice and select all that applies like I normally do, this Kahoot will be mostly word cloud. So I'm going to ask you something or ask about a particular subject, and you just type in your answers and we'll talk about the answers. We'll talk about what the correct answer is. And I don't know how this is going to go. So after this, please let me know in the comment section if you like this type of Kahoot or the normal traditional type of Kahoot that I normally do. So go ahead and let me know in the comment section after this video. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. So go ahead and give it the thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And if you're studying for your boards, go ahead and register for an NCLEX review with me right now. Go to my website, nexusnursinginstitute.com. You can reserve your spot for an NCLEX review, or if you're currently in a nursing program and you need help, you want a one-on-one tutoring session, or you've graduated, but there's something that you just like to have my undivided attention, go ahead and reserve your spot. Again, nexusnursinginstitute.com. While you're there, be sure to check out the audio lessons that I have available. Without any further ado, guys, let's get started. Mixed. This is a mixed group of questions and contents. Word cloud. So name one thing you should teach your patient regarding bisphosphonates. What is one thing your patient that has osteoporosis, they're going to be taking this class of drug? What would you teach them? Go ahead and type in your answer, guys. Name one thing you teach your patient taking bisphosphonates. Okay, let me move this so I can see what it says. It says take in the AM, immunity, stay out of the sun, no exercise, stand for 30 minutes, sit upright. After 30, how to take it. Sandrine, no smoking when taken. Okay, so let's talk about it. There's over 50 people in this room. How did I think only 11 of you guys answered? But anyway, some important things for you guys to know about bisphosphonates, drugs such as Fosamax. You're going to teach the patient to take it in the morning on an empty stomach with a full glass of water, okay? And it's very irritating. We don't want the patient to experience any reflux, because if it does, that medication, like I said, is very irritating. It will absolutely burn the esophagus. It will cause irritation, maybe even erosion. So you're going to teach that patient, after they take that medication on an empty stomach in the morning with a full glass of water, to make sure they're sitting up for at least 30 to 60 minutes. They cannot lie down afterwards. This patient is taking this medication. We're going to teach them about how to preserve the bones that they have. We're going to teach them about exercise, weight-bearing exercises. We're going to teach them about vitamin D, because vitamin D helps you to absorb calcium. We're going to teach them about what else are we going to teach a patient in regards to this medication? We're going to teach them about the side effects or adverse effects of this medication, about potential diarrhea, nausea, flu-like symptoms, joint pains that they should report if they experience those type of adverse effects in regards to the medication. And of course, no smoking. We always going to tell the patient to stop smoking. Absolutely. Very good. Select all that applies. What are the symptoms of glaucoma? So this is select all that apply, guys. What are the symptoms? Here are your choices. Eye pressure, headache, halos around lights, blurred vision, narrowed vision, also known as tunnel vision, or blind spots. What are the symptoms of glaucoma? Select all that apply. Everyone on the live is surprised. Yes, this is a different format that I'm using. Let me know what you guys think about it. Do you like the fill in the blank, or do you prefer the select all that applies or multiple choice? Okay, all of them. All of these are clinical manifestations of glaucoma. Remember, guys, glaucoma is that increased ocular pressure that the patient may have in the eye. They may experience eye pressure. That eye pressure may give them a headache. They may report seeing halos around lights. They may report having blurred vision. They may report having tunnel vision where they can see straight ahead, but not the periphery. They may report having blind spots. All of these are clinical manifestations of glaucoma. Here's another word cloud. Anyone with an eye pressure that exceeds what should be suspected of having glaucoma? If their eye pressure exceeds what number, should they be screened more closely? Should they be referred to an ophthalmologist for glaucoma? What is that number? What is going on here? I'm seeing 60. 90, 180. Okay, so I'm seeing a lot of guesses. Somebody didn't even put in the number. They just said immune. So the correct answer, guys, is 21. Your normal range is 12 to 21. Anything that exceeds 21, the patient should be suspected of possibly having glaucoma and they should be screened further. Okay, so the correct answer is 21. Another word cloud. What is a risk factor for osteoporosis? Go ahead, type it in, guys. What is a risk factor for osteoporosis? What do you think? You guys are doing great on the live. All right, let's see. Low calcium, low vitamin D, smoking, being a woman. Let's be more specific. Genetics, yes, but let's be more specific. Old age, obesity, vitamin D deficiency, birth control. Let's be more specific. Losing calcium. Okay, so let's talk about this, guys. Risk factors for osteoporosis. Yes, being a female, being an older female, being a postmenopausal female. Remember, guys, when you go menopause, that's when the estrogen level is severely decreased. And estrogen is to the woman what testosterone is to the man. So when the estrogen level is decreased, what that does is allows that calcium that was hanging out in the bones to go back to the blood, right? And so for men, as men get older, their testosterone levels tend to decline. Men with lower testosterone levels are also at risk for osteoporosis because as the testosterone level declines, the calcium, again, that was hanging out in the bones, go back to the bloodstream. So low testosterone for men, low estrogen for women. Women who are taking oral the birth control, what do you call it? Oral, guys, tell me on, thank you. No, that's not what I'm looking for. Tell me on the live, guys, what's the birth control? Oral what? I'm looking for a term. It's not coming to me. Thank you. Oral contraceptives. Thank you. Thank you. Patients taking oral contraceptives, that places them at risk for osteoporosis. Absolutely. Malnutrition, decrease calcium, decrease vitamin D. I saw this a lot on the live and you guys were absolutely correct. History of fractures, falls, specifically any patient who has a history of hip fractures, that increases big time their risk for osteoporosis. Very good. I don't know if I'm supposed to click on the correct answers, if that goes towards your points, guys. I should have read up on this Kahoot before I made it, but we'll see. What would be a priority concern for the patient admitted in the manic phase of bipolar disorder? Did you do your homework? Yeah. Okay. What would be the priority concern for a patient admitted in the manic phase of bipolar disorder? Type in your answer. What would be a priority nursing intervention? Your patient just came in and they are in the manic phase of bipolar disorder. What's going to be your priority? Okay, I see hurt themselves, low stimulus in room, nutrition and safety, risk for injury, safety, suicide, anger, suicide, safety, self-harm. Let's talk about this. So the patient who is in the manic phase, okay, because when the patient has bipolar disorder, they can be in the manic phase, which is one end of the spectrum, or they can be on the opposite end where they're depressed and they don't even want to move. When they are in the manic phase, they are happy. They are like in a high. They are all over the place. They're talking to everyone. They're starting all of these projects, but they're not finishing the project because they keep moving on to the next project. They are all over the place and they're going and going, 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 and they're not even stopping to eat, to drink, to sleep. So the patient that's in the manic phase, what we're going to be concerned about is fluid and electrolytes, because you can live a couple, weeks without food, but only a couple days without water, right? So fluid and electrolytes, nutrition, rest, and of course, safety. But I want you to think about it. How's that patient going to be safe if they're dead because they have no fluid and electrolytes, they're severely dehydrated? Right? So all of those are concerns. I saw a lot on the live. A lot of you guys said a suicide. We absolutely, of course, will be concerned about suicide. There may be suicide ideations, but we see that more when the patient is on the opposite end of bipolar disorder, not so much when they are in the manic phase. When they're in the manic phase, they tend to be very happy. They're just on a high. They're all over the place. Okay, so it's going to be fluid and electrolytes. It's going to be nutrition. It's going to be rest. It's going to be, of course, safety. This patient that's in the manic phase, when I tell you they're going, going. They're not stopping to eat or drink. So you need to give them finger foods because they're not going to stop to eat a steak and potato. You better give them a sandwich and a bottled water so they can eat and drink as they go. Here's another word cloud. What types of food should be avoided in the patient taking MAOIs? Type in your answer. What type of food do you think should be avoided in the patients that are taking MAOIs? That's what I'm talking about. All right, lots of great answers. Aged cheese, anything with, I think you were trying to spell tyramine. I know what you meant. Anything with tyramine, cured meats. Let's see. Yep, tyramine, cheese. Again, guys, don't only say cheese, aged cheese. Let's see. High tyramine, yep, grapefruit, those things with high citrus, they're going to be high in tyramine as well. Fermented, yep, anything fermented, anything pickled, avocado, chocolate, anything that would go on a charcuterie board, any deli meats, red wine, very good. Next question, what does this say? Name a risk factor or nursing intervention for the patient with meningitis. So I'm giving you two options, guys. Either name a risk factor for a patient with meningitis or name a nursing intervention. What is something you do for a patient with meningitis? Miranda said, how many questions are there? 11. There are 11 questions. We're on number 7. Okay, so let's look at the correct answer, guys. I see isolation. Absolutely. What type of isolation? That patient's going to be on droplet. You're going to give the patient fluids, bleeding of the gums for meningitis. I don't know what you're talking about. I'm sorry. Prevent infection. I mean, prevent further infection because they got meningitis. They're already infected. I guess you mean further infection. I'll take that. Yep. Isolation precaution. Yes. Teenagers, older adolescents, young adults, they're at high risk. Absolutely. Being in the college dorm. Yep. Being in an army barrack or military barrack, being in a prison, being anywhere where there are a lot of people in a small space that increases your risk. Let's talk about nursing interventions. Like you guys said, isolation. You want to make sure that that patient is on antibiotics for at least 24 hours before they come out of isolation. You want to put that patient on seizure precautions. You want to make sure that the patient doesn't develop increased intracranial pressure. You want to keep the head of the bed at 30 degrees. Lots of nursing interventions. Very good, guys. What's an important nursing assessment to take before administration of digoxin? What is something that's important for you to do as a nurse before you give digoxin to your patient? Type in your answer. Okay, wonderful. I'm seeing lots of nursing interventions. On all of these are wonderful, not all of them, but most of these are wonderful nursing interventions. Let's talk about digoxin first of all. Guys, this is a cardiac glycoside. This is a wonderful medication for somebody who has something like congestive heart failure because this medication increases the contractility of the heart. It makes the heart pump out more oxygenated blood to the tissues that really need it. Wonderful. However, a side effect of this drug is that it decreases the heart rate. So before you give this medication to a patient, you need to take that apical pulse. You need to take it for a full minute. Remember, the pulse is supposed to be 60 to 100. If you take that apical pulse for a full minute and it's less than 60, you're going to withhold that medication, call the healthcare provider. You are not going to give that medication, okay? What are the classic symptoms of Parkinson's disease? What are the classic symptoms? Can you think of at least one? A classic symptom of Parkinson's disease. Patty, great job. I forgot about that one. Tremors, rigidity, yep, tremor, bradykinesia, ataxia, yep, shaking hands, the tremors, pill roll, yep, just like in the picture, muscle weakness, rigidity, yep. Those TRAP symptoms, TRAP, T for tremor, A for ataxia, no, tremors. T is for tremor. What's my R for? R is for rigidity. A is for ataxia. P for postural instability. Patients got the shuffling gait. Other concerns. Someone mentioned it in the live. I forgot about that. Yep. The drooping eyes. Yeah, you'll see that. The masked face, where basically you can't tell if they're happy, they're sad. They just have that same face regardless of the emotion. A concern is going to be possible drooling because we're going to be concerned about aspiration. We're going to be concerned about falls because of the drooping, because of the shuffling gait, you know, the pill rolling, the tremors. Something else that's very important that you guys need to know when it comes to Parkinson's disease, the neurotransmitter that is lacking or deficient or low in Parkinson's disease is what? What do you guys think? Tell me in the live. What's the neurotransmitter that's low in Parkinson's disease? That's right, dopamine. Dopamine. Very good. An infant's birth weight should it should double by blank months of age and triple by blank months of age. So an infant's birth weight, when should it double and when should it triple? I'm seeing 2 months, 3 months, 4 months, 6 months. Okay, guys. So the weight should double by 6 months and it should triple by 12 months. So it's 6 and 12. Double by 6 months and triple by 12 months. A for effort, though. Okay, open-ended. What is an example of a primary prevention measure? Give me an example. You have primary prevention, you have secondary prevention, you have tertiary prevention. Give me an example of a primary prevention measure. Okay, less than half of you guys submit an answer. Let's see what they are. Vaccines, education, hand washing. So let's talk about the difference, guys. In primary prevention measures, the patient does not have it and you want to prevent them from having it. So educating them about how they can prevent themselves from getting it, or giving immunizations to prevent them from getting whatever it is. That is primary. The patient doesn't have it. We don't want them to get it. So we're doing these measures, right? Secondary prevention measure would be something where the patient might have it. We think they have it. We want to see how bad it is. So it would be something like a biopsy or a mammogram or a colonoscopy. So that's primary, secondary. Then you have tertiary prevention measure. Tertiary prevention measure, the patient got it, unfortunately. We just want to prevent it from getting worse. So something tertiary would be something like, physical therapy, occupational therapy, some type of therapy, something to keep it from getting worse. Okay, so when we're talking about primary, again, the patient doesn't have it. We want to prevent them from getting it. It would be something like hand washing, education, immunizations. Very good. Last one. Name a do or a don't of mental health nursing, of psych nursing. Name something that you should do or that you should never do. Go ahead. Sound off in the answers. Okay, so let's talk about this. I'm assuming do not be hostile. Do not feed into delusions. Yep. Do not hit someone. Do not date the patient. Correct. Do not be judgmental. That is a biggie in nursing. That is a biggie. Do not retaliate. Do not ask why. That's another biggie. Reinforce reality. That's right. So if a patient's hearing voices that are not there, you say to the patient, I do not hear anything. So when you put it on yourself, You're not making them feel bad. You're not blaming them. You're not putting them in a position where they have to defend themselves. But at the same time, you're reorienting them to reality. You're telling them that I don't hear any voices. You're here because, and then you explain the patient's diagnosis, you explain their disease process, and you bring them back to reality. For vaccinations, I'm not sure what you're saying about vaccinations, and do not harm, absolutely do not harm. Let's talk about some important do's and don'ts when it comes to psych nursing. You never say why. You never say what made you, because those two statements, you're putting the patient on the defensive. In psych nursing, you never turn your back to the patient, especially the patient that is aggressive. If you have to walk out of that room, you are walking out backwards, right? You keep your eyes on that patient and the exit at all times. You never raise your voice at a patient. You never enter into power struggles with a patient. You never keep secrets for a patient. If a patient says to you, I have to tell you a secret, but you have to promise not to tell anyone, you tell that patient outright before they even tell you what the secret is. You tell them, if this has anything, if it's going to affect your care or anyone on the floor, on the nursing unit, I have to tell. I will tell your healthcare provider. I will tell the other nurses. I will tell the team. You let that patient know in advance, and then you let them decide if they want to tell you or not. Why? Because you have to always be truthful to the patient. You don't lie and say to the patient, okay, I promise not to tell, and then you go ahead and tell, because guess what? You are a mandated reporter. So you tell that patient in advance that you're there to care for them. And if it's something that's going to affect their care or anyone else, that you're a mandated reporter, yes, you will tell. More do's. Therapeutic communication. You always want to ask open-ended questions because you want the patient to express themselves. There are very few situations where you ask closed-ended questions. Now, I've talked about this a million times. Those situations are in the case of suicide, in the case of abuse, or in the case of quick assessment. Those three situations, you're going to ask closed-ended questions. Other than that, you want to ask open-ended questions. And I think that was our last slide. I'm not even sure if it's going to tell us how you guys did at the end. Like I said, this is my first time doing this type of Kahoot, but let's see how it goes.